Hey there, this is Dr. Olm with Dr. Muse. On this video, we're going to talk about, is the McKenzie Method safe? And the short answer is yes. Now, this is something that we use very often in the clinic, both for evaluation and treatment, but the answer is it's a very, very safe and effective way to treat spine pain, joint pain, general musculoskeletal pain.
Yeah, and one reason why it might be a safe treatment approach that we can use is that we use something called a progression of forces. So when somebody comes in with, let's say, neck pain, very often, or I would say 100% of the time when you come into CCRC, we are not starting the treatment with a neck adjustment. That's what we would say is on the tail end of a progression of forces. If we want to start safely, then we might have the patient begin with just on their own, going through a motion like this, and then they have complete control over how hard or how often they can do this. Then from there, as long as we deem it a safe move to be doing with that individual, we may begin to add some what's called clinician overpressure, where one of the doctors may add their hand and add a little bit more force to that. But that's one way that we can make this a safe treatment. Let's talk about one other way that we can go about that.
Just to add on to that, the first movement, we call that patient generated. So it would be you, the patient, actively pulling back in this case, or maybe doing a gentle press-up position, and then you, the patient, would add the force. So you have complete control over it. You would then progress to clinician-generated. Two other ways we do it are the range of motion that we're exposing the body to, and then also we're going off of symptom response. So just to handle the range of motion one first, you can go to partial range of motion or full range of motion or end range of motion. That's one way that you can do it. The amount of force that you, the patient, or us, the clinician, are applying to the movement is another way. And then the biggest one that I think is critical, and one of the reasons why McKenzie is so powerful, is we're basing everything that we're doing off of symptom response. And what that means is, based on the conversation that we have in the office, no matter what you're dealing with, we're going to ask you questions like, what makes it worse? How did this happen? When you're feeling the symptoms, what can you do to make it feel better? And then we're going to base the treatment, the initial movement that we're going to test on you, on that conversation. And then we're going to reevaluate how you responded. How is the pain? How is your range of motion? How is the sensitivity in the body? Go back and test orthopedic tests or neurological tests. And that's going to tell us whether what we did was helpful or whether it actually might have, worked you backwards a little bit. And because we go so slowly with those graded progression of forces, and we're constantly reevaluating you, it not only makes McKenzie super, super safe, but it makes it incredibly specific to you, the patient. And that's one of the reasons why I think it is so powerful, because it's safe and it is highly specified to you. So now our treatment plans are patient-specific and not treatment-specific.
Absolutely, and the individualized treatment plans with the McKenzie Method is a major reason why we deem what we do here at CCRC safe. Very often we hear that going to the chiropractor could potentially not be good for an individual, but when we're going about it in a way like this, it's individualized, it's a progression of forces, so we know exactly how you're responding as we go, and those are some ways that we can keep the treatment safe for any and all that come into CCRC.
So there's the long and short of it. The answer is it's safe. The answer is it's highly specific to you, and all the doctors in this office, use this on virtually every patient that walks in the door. So if you have any more questions, feel free to reach out, and we'd love to answer them for you.
Thanks.